Millions more Californians, including those with underlying health conditions and disabilities, can qualify to get vaccinated beginning Monday. Some of those seeking the vaccine will likely face frustration because of limited supplies. At the same time, people are being asked to follow an honor system of sorts, signing up only if they truly qualify. Indeed, officials are urging California not to cheat and to avoid getting inoculated ahead of others on the priority list. "We don't feel that our frontline staff are in a position to screen and make decisions about who is not eligible," Dr. Paul Simon, Chief Science Officer with the Los Angeles County Department of Public Health, said Friday. "We urge people not to take advantage of that. Here are 5 things to know about the process." The new guidance's allowance for self-attestation clears up confusion about how high-risk people can prove their eligibility. Advocates have long pressed for a process that would not create unnecessary barriers, especially for those who are less mobile or intellectually disabled. Under the guidelines, people do not have to disclose what condition they have, only that they are eligible, Simon said. The state guidelines for at-risk people essentially trust residents to accurately disclose their eligibility, but some officials have expressed concern that the lenient rules will be abused by people faking underlying conditions. People have forged documents and used access codes intended for high-risk communities. "We certainly hope people won't try to take advantage of the situation and will be honest in terms of presenting with legitimate chronic health conditions that are serious, and/or disabilities that are significant," Simon said. The addition of millions of Californians to the eligibility list will place additional burdens on a vaccine supply that has grown steadily but not significantly. California is reserving 40% of its supply for people in underserved communities and 10% for teachers. And there are still many people 65 and older who are waiting for their vaccinations as well. Further straining tight supplies. The state on Monday is also expanding eligibility to people who live or work in high-risk congregate residential settings, such as homeless shelters and incarceration facilities, and to public transit and airport employees. In LA County, the entire homeless population will be eligible, regardless of shelter status. L. has struggled with vaccine supply levels and is working to address issues related to mobility, accessibility and equity even as the new groups become eligible. Adding to that challenge is that fact that allocations of the Johnson & Johnson single-dose vaccine will come to a near halt over the coming weeks while the company works to ramp up production. People ages 16 to 64 can be eligible if they are deemed to be at the very highest risk to get very sick from COVID-19.